Good morning, everyone. Welcome to Alice Lee Center for Nursing Studies webinar series. I'm Wen Tao, the Master of Nursing Program Director at Alice Lee Center for Nursing Study, Yang Luling School of Medicine, National University of Singapore. I will host for today's session, Advanced Practice Nursing, Shaping the Future of Healthcare. Together with me, we have three guest speakers, APN Liao Wei Fun, Dr. Bridget Wu, and Prof. Ruth Klempel. As everybody knows, advanced practice nurses are in high demand globally, as well as in Singapore. Minister of Health recently announced more APN are needed in Singapore because they play the essential role in advancing for nursing, as well as leading for a sustainable healthcare. Therefore, promoting and understanding of the APN roles and practice are important. In today's webinar, our speakers will bring you through how APNs contribute and will value added to the healthcare system in Singapore. First, I would like to invite Prof. Emily, Head of the Department of NUS Nursing, to give the opening speech. Prof. Emily, please.
A very warm welcome to our webinar. Thank you for your support. I'd like to introduce briefly our department to all the participants. Our department is known as the Alice Lee Center for Nursing Studies. It is within the Yong Loo Ling School of Medicine, National University of Singapore. NUS is Singapore's flagship university and a leading global university centered in Asia. We offer undergrad and postgrad programs and have a total population of over 1,000 students. Our research program covers the following: chronic illness and long-term care, women and child health care, patient safety and quality of care, geriatric care, and wellness. I hope that you can go to our website to learn more about our department and our research program, and we welcome all of you to collaborate with us in the future. Let me once again thank you for participating in this webinar, and I hope you have an enlightening one today.
Thanks, Prof. Emily. I really hope our webinar series will bring local and international nurses together to uplifting nursing profession. So let me start the ball rolling. I'm very humbled and pleased to share with everyone for my today's topic, which is advanced practice nursing in Singapore, present and future. So this will be my today's content. I will brief through all the components. So in recent speech, Minister of Health mentioned Singapore aims to have up to 700 APNs can prescribe medication by 2030. By seeing that, till today, we have total 294 APN registered APN. 57 of them have prescribing right. If the goal is 700, we still need 400 more by 2030. So let us look at who are the APNs. APNs is registered nurse, has acquired the expert knowledge, complex decision-making skills, and clinical competencies for extended clinical practice. Is trained in the diagnosing and management of common acute and chronic medical conditions. So the scope of practice entails how the acquisition of the competencies to be applied in the clinical context which APN is certified to practice. The APN is a legal protected title in Singapore. So Singapore has adopted a hybrid model for APN practice. 80% of the nurse practitioner roles, which provide direct care, provide care consult. 20% of clinical nurse specialist roles to conduct teaching and education, support of the healthcare system, and lead for research. So this is actually aligned with our local study, which stated APNs spend about 50 to 80% of their time on direct comprehensive care. So you can see over the spider web chart. And also they spend about 50 to 80% of the time provide education, 30 to 50% of the time to support the healthcare system, and 10 to 30% of their time to do research and publication. So let us have a close look of Singapore development milestone. The APN training was established in 2003 under School of Medicine, Division of Graduate Medical Studies. So 2 years down the road, in 2005, Singapore Nursing and Midwife Act was amended, which included APN register. In 2006, criteria for APN certification drawn up. The following year, we have the first batch of APN certified. In 2009, the APN training was shifted from the DGMS to the Ellerslie Center for Nursing Study. So Ellerslie Center for Nursing Study was established in 2005. So at that moment, we only have medical, surgical, critical care, and mental health track. 3 years down the road, APN training for pediatric was established. And in 2014, there is a significant milestone. National OSCE was adopted for APN certification instead of panel interview. So it's a more structured certification process. And another key milestone is in 2018, National Collaborative Prescribing Program was established. So to enable the APN can practice on top of that lesson. And in recently, 2021, summative clinical portfolio was introduced in the integrated APN internship to replace the previous certification process, certification mode, which is National OSCE. So now let us to be better understand, to be a registered APN is a long journey, tough journey, but it's a rewarding journey. So to become an APN, first you need to apply and enter to the Master of Nursing program. And you must minimally have 5 years working experience as a registered nurse. Then you need to complete the 18 months program and proceed to your APN internship. So it's here. During the internship, all the interns need to complete a 12 months integrated APN internship, then get themselves certified as registered APN. After become a registered APN, all the APN need to go through the renewing their license yearly. So this is the journey of how an RN, registered nurse, to become a registered APN. So this is the figure to share with everyone. The purple color is represent the Master of Nursing training. The yellow color is indicate the integrated APN internship. This is an overall APN training plan from become a student until complete their internship. So in the recent years, in order to align the expectation to support our students have a smooth transition from learning to become an interns and to successfully become an APN, we have adopted entrustable professional activity to align the whole journey and align the expectation among all the stakeholders. So in the latest integrated APN internship, if the APN interns adapt well for their learning during the internship and they perform on the par as expected, they can join the National Collaborative Prescribing Program by month 6. So APN has contributes a lot to Singapore healthcare. First, they involve in providing care for the adults population. They provide emergency care, provide in-depth inpatient care, lead for specialty outpatient care, and specialty center care. They engage and set up for the hospital transitional care. They anchor for primary care, provide health care promotion, disease prevention education, provide chronic disease management, initiate acute health problem management in polyclinics. And they also drive for community care, set up and initiate for community care, provide home care, provide consultation for nursing home care, provide palliative and end-of-life care. And also, many of our psychiatric APNs involved in the psychiatric care, participate in acute and chronic psychiatric care for young and old, provide care service to inmates with mental illness. And they involve in pediatric care as well, provide emergency, inpatient, outpatient care, and also engage transitional care. The most important things are they lead for quality of care, providing nursing education, develop evidence-based practice, conduct research, improve care process, and involve in policy development in Singapore. So for APN practice is evolving. By looking at this chart, clinical nurse specialist roles and nurse practitioner roles are all under advanced practice scope. So in Singapore, moving forward, we need to practice on top of the lesson to maximize care outcome. We need a balance of nurse practitioner and clinical nurse specialist roles based on the service needs. We need to utilize the prescribing rights to expand the scope of independent practice under collaborative agreement. We need to embrace technology and implement innovative clinical service to streamline care process and cost saving. We need to collaborate with interprofessional teams to develop evidence-based practice guidelines. And the most importantly, we need to develop new nursing knowledge through research together with scholars. With this, APN also need to practice based on the holistic health concept beyond just illness treatment. Besides provide medical treatment, they need to modify the healthcare behaviors for patients, change living environments for our patients, and address some of the social economic factors for our patients to ensure the care provided are holistic. And we already know Singapore is emphasizing shifting the care from hospital to community. That applies to the same thing to our APN practice. We need to practice beyond the hospitals to community to ensure care accessible and affordable. So last but importantly, APN need to influence and shape Singapore healthcare. Pandemic to endemic, mode of care deliver of change fast and unpredictable. Adopt and adapt for the change need to be on time. Healthcare leaders required to have diverse capability and clinical competencies for adapting the change. While APNs are trained with diverse competencies, they are versatile, flexible, adaptable, and system-focused. Therefore, APN are in the strategic position to work with other stakeholders to influence, lead, and shape Singapore healthcare now and in future. With this, I close my sharing for today. If you have any question, please type in your questions in the Q&A chat box. We will address that later. Okay, so now I move on to introduce our second speaker, APN Liao Wei-Fung. Wei-Fung works as an APN at National University Polyclinic. She was certified as APN in 2008 and obtained her collaborative prescribing right in 2018. She looks after patients with chronic disease at Polyclinic and runs APN-led atrial fibrillation clinic in collaboration with NUH cardiologists. She oversees the APN development at National University Polyclinic and actively involves in APN education development with Ministry of Health National APN Work Group. Her topic for today is Advanced Practice Nursing in Primary Care. Wei-Fung, please. Thanks.
Okay, thank you so much, Wen Tao, for your kind introduction, and thank you everyone for attending the talk today. It's my pleasure to share with all of you on advanced practice nursing in primary care. So before I deep dive into the advanced practice nursing roles in NUP, just to share with you on the history of Singapore's primary healthcare system. So in Singapore, as you all know, or those of you who are old enough, you will actually encounter when you're during your childhood days, you have outpatient dispensaries dispensing medication, and all these dispensaries also see the pregnant mothers and the children in the clinics. Very much a lot has actually evolved over the years. Besides just dispensing medication, the polyclinics have actually evolved into bigger healthcare clusters. And in the 1980s to the 2000s, polyclinics have become a one-stop center for more than just maternal and child health services. So, and back in the 2000s, in the year 2000, a lot of modernization has been done to our clinics, and our latest clinics are actually not just a single-story building where we have up to 7-story building, and in the future we will have even step-down care services like nursing home that is parked next to our clinic or within the clinic itself. So in the year 2017, as we all know, we actually have been integrated into 3 clusters, and mainly these 3 clusters consist of 20 polyclinics at this point in time, with 6 in NUP alone. And the services that we have been providing are essentially one-stop services. Besides outpatient medical treatment, there are follow-ups after discharge from hospital. So we're doing a lot more on step-down care, as well as maternal child health, immunization, health screening, and diagnostic and pharmaceutical services. So why is there a need for advanced practice nurses to practice in primary care? And as we all know, the disease burden in Singapore is very prevalent among our adult populations from 18 to 69 years old. And most of our resident patients that we see have chronic diseases, mainly diabetes, hypertension, and hyperlipidemia. And if you can see over the years from 1992 up till 2017, the numbers has not dropped drastically. In fact, it has been remaining rather stable, with some conditions like hyperlipidemia moving up, as well as diabetes and hypertension. So there is a lot to be done in terms of chronic disease management in our population. So the top 4 conditions for polyclinic attendances, as what I have also highlighted, are chronic diseases, and up to about 10 or 15 to 15% of patients have hyperlipidemia, hypertension, and around 10% have diabetes. So you can see the total number of attendances over 2015 to 2019 has significantly increased over the years. And why is this increase happening? Mainly, the disease on the rise are due to the aging population. And as we all know, by the year 2030, 1 in 5 Singapore residents age more than 65 will be more than age 65. And with that, the increase in numbers of diabetes, heart attack, cancer, and stroke, and so on and so forth will be expected to increase over the years. So there are a lot of challenges for us addressed in the entire healthcare system in Singapore, and a lot can be done within primary care as well. So the challenges that we have been addressing over the years, not just moving towards 2030, but in the recent decades, has been on curbing the challenges faced with aging population, where patients come in with multiple comorbidities, increased healthcare burden, and because of that, more and more patients are getting more complex in their condition, and this causes a lot of resources needed to pump in to tackle these issues. And we also realize that there is a lot that needs to be done to collaborate with inter-institution between primary care, community, as well as the hospital to tighten this fragmentation of care within the healthcare setting. And with the increase in patient expectation, with their increased educational standard and accessibility to internet, social media, a lot of patients expect a lot more from us, and it's not just the basic the healthcare provider is the main driver for the for disease management. The patient themselves actually needs a lot of education and participation in their care as well. So I understand that most of us will know about the 3 Beyonds, and what I would like to actually focus on is what we have done in terms of these 3 Beyonds in a primary care setting. So NUP involvement in the key initiatives in the 3 Beyonds has been consistently, actively ongoing. And with the drive to go beyond primary care from hospital to community, meaning primary care and the community sector, there are a lot of initiatives that's ongoing, which I will not go into too detail. But what I want to highlight is one of the value-driven care that we have been actively involved in as APNs in primary care is Project Vector. So in Project Vector, the aim is to right-side patients of care from acute hospital in order to strengthen primary care and prevention and reduce unnecessary hospital visits and in fact also SOC referrals. So later I will be sharing with you what we have done in terms of APN involvement in this initiative. So let's just go on to the advanced practice nursing in NUP. More of the perspective is more shared within this NUP setting where I'm from. Okay, so Wen Tao has earlier shared on this slide that there are more APNs that are needed to be developed by the year 2030, and we still have about 400 more to develop. So this is really a very high arcing goal. And currently, if you can zoom down to see the community health APNs, and the year 2019 is 22. And as of now, we have up to 24 APNs across the 3 clusters, with some of them doing their internship. So the numbers are slowly increasing, but in order to achieve the high arcing goal of 400 APNs by the year 2030, a lot needs to be done in terms of the development of APNs. So the number of APNs in NUP is very lean. There are 6 polyclinics in the western side of Singapore where NUP resides. And there are actually only 6 of us in practicing across 3 clinics out of the 6 clinics, with 3 in Bukit Batok, 1 in Jurong, 1 in Choa Chu Kang, and 1 intern is obtaining her certification this year, and after which she'll be practicing in Bukit Panjang. So essentially, the clinical role of APN in primary care is not any different from our core essential role as an APN in terms of clinical role, meaning these are all that we do, right? Basically, this is our essential role. And for primary care, we do manage a lot more chronic disease and also common acute conditions besides just focusing on chronic disease. So the core of our practice is, besides clinical, essentially we are trying to identify disease exacerbation during our consultation and ensure that patients' risk factors are being assessed, and as well as allowing them to go for preventive and preventive care. So meaning preventive care is such as vaccinations, the women's health, pap smear, mammogram, that can all be done in the polyclinics. And moving forward, we'll also be doing a lot more osteoporosis screening, as well as frailty screening in the clinics as well, and empowering patients to self-care and monitor their outcomes. So these are some of the essential roles that we do day in and day out. So what about collaborative prescribing? I think Wen Tao has mentioned about collaborative prescribing earlier in her talk. So in terms of collaborative prescribing, we are getting trained over the years since 2018. And with Singapore aiming to have up to 700 APNs to prescribe medication, a lot of APNs will be sent for collaborative prescribing course and getting themselves certified. So in NUP, those of us who have gained the collaborative prescribing rights have found that there is a lot of increased level of autonomy given to us after the collaborative practice agreement. And we feel that there is more empowerment in our patient care, and therefore these enhance our role recognition, not just for patients, but also among the other healthcare providers. And doctors really appreciate our value-added services where we no longer need to go to them for all medication approval. And more patients have also increasingly accepted APNs to prescribe medications for them and manage their conditions. So I think this is really something that we need to really continuously achieve for all APNs in primary care. So just an overview of the numbers of APN CPP. So we have 50% of us certified, with the other one waiting for CPP application, and another one completing her course by the end of this year, and another is an intern. Okay, so the scope of APN practice in NUP are, in a nutshell, summarized in this slide. So for year 1 across to year 3, we have to be competent to manage chronic diseases across the years, and including that the chronic are the acute conditions that we need to manage as well. So this list is not exhaustive. Constantly we are working with family physicians for training, as well as on the job training to allow APNs to expand their scope of practice in these areas. And as Wen Tao has mentioned earlier, if you remember, we need to harness technology to reduce healthcare costs for our patients. And one of the things that we have started doing is a teleconsultation for our chronic disease patients. And in time to come, we will be moving towards video consultation as well, so that patients do not need to constantly come to the clinic to see us, and they can be remotely be assessed at home. Okay, another key feature that polyclinic APNs are striving to achieve is to be able to work with the team-led care. So if you know of a primary care setting, we have a teamlet care model whereby patients are empaneled to about 4,000 to 5,000 patients in a teamlet. So within the teamlet, there is a group of healthcare provider, namely 2 family physicians, a care manager and a care coordinator, looking after these patients to provide a more personalized and long-term care for this patient. Because teamlet and teamlet based care has proven to be effective and proven to have better outcomes and allow healthcare providers to practice on top of their license. So what we have done over the recent years is for APN integration into teamlet across 2 clinics, mainly Jurong and Choa Chu Kang Polyclinic, whereby the APNs have been soft merged into the teamlet with co-location, helping to manage the patients within the team and allow team huddles and multidisciplinary discussion within the team. So the APNs are not just working solely alone in their APN-led clinics. Another benefit of patient empanelment care model in primary care is that we are able to categorize our patients into categories. So with Cat A, B, and C patients moving across all the teamlets, and within the teamlets itself, the APNs can actually manage more on the Cat B and the Cat C patients while leaving the more stable patients to care managers to take care of this group. So we can actually allow better utilization of healthcare resources among the team members, basically the expertise among the team members as well. Okay, so now let's move on to talk about the integrated chronic care clinic for atrial fibrillation by APNs. So this clinic was actually started by a collaboration, a research study done by Bridget, who will be sharing later after myself. So it's actually a research study that was started and by Bridget as well as the cardiologist from NUH. And what we have done is that we have started actually way back in the 2017 to 2018 in this clinic. And essentially, why do we want to manage AF? So AF management is very much a multidisciplinary approach whereby you need a lot of team members of the healthcare team to manage patients because this group of patients are a little bit more complex and they really require a lot more patient education and self-management on top of their clinical care. So every one of the AF patients are different, and in order for us to really go in depth into their care, we need to have a team of healthcare providers, just like the teamlet care model, but the team that is a consistent team looking after this group of patients, because these patients are typically of high to moderate risk for stroke. And if you can see from the Garfield AF study, the characteristics of patients are no different from our local setting in Singapore, or rather in Bukit Batok Polyclinic that we see. So a lot of care will need to be done for this group of patients. So in our integrated care clinic, we don't just look at AF. The term integrated means that we consolidate all the care within the clinic by having patient to be managed, not just the AF, but chronic disease management as well. So in this AF clinic, when the patients are first diagnosed, the family physician will first review the patient using a clinical decision support protocol drafted by the cardiologist. And there will be early Holter to be done for patient if necessary. And patients will also be sent for early echo. And after which the patient will return for their review at the APN-led clinic, whereby we will review them for chronic disease as well as AF, educate them on the anticoagulant, and to start them on anticoagulant if necessary. and the rest will be to assess them on functional 4-risk assessment and so on. So the cardiology input will be more for complex cases, and this remote specialist consultation is actually very beneficial for our team. So essentially our team are the cardiologist, family physician, myself, and I'll be roping in more APNs into this clinic as well, and including Bridget and the care coordinators. So this is my last slide. If you were to ask me what are the challenges and opportunities for developing APNs in primary care, I think I resonate a lot in this study, which is a review done by International Journal of Nursing Studies on what are the barriers and also opportunities that we face. And this is not just only in hospital. I guess it applies to all of us here in primary care. A lot of times I feel that the challenges and then the opportunities as well are what are important are team factors. So building relationship, building collaboration across teams and profession and specialty are important for the APN role to succeed, as well as the need for us to be clear in our roles and clear in supporting the APN role with ongoing education and training to expand our scope of practice. And supportive leadership and team involvement are important to further develop the APN roles and to agree on new models of care. And with that, I thank you for your attention.
Thanks, Wee Fong, for the insightful talk. And I agree with you totally. We need more APNs in primary care. So Wee Fong have shared with us the scope of APN practice in Singapore, as well as the potential challenges and opportunities for develop APN in primary care. She has nicely introduced our next speaker, which is Bridget Wu. Bridget is the research fellow at US Nursing. Her research is centered around role utilization and professional development of advanced practice nurse in Singapore. She has published a significant number of APN-related studies, and one of her studies is advanced practice nurse that integrated care, chronic care, enhanced atrial fibrillation clinic in the community. So now I will pass the time to Bridget. Bridget, please.
Hi, good morning, everyone. Before I begin, I'd like to just thank NUS LEC Center for Nursing Studies for giving me this opportunity to share my presentation on an advanced practice nurse-led integrated chronic care enhanced atrial fibrillation clinic in the community. So in today's presentation, I'll be sharing some preliminary findings from this study. Okay, so Singapore, like many developed countries in the world, we are aging very rapidly. By 2030, we are projected to have more than 25% of our population over the age of 65. And it's quite daunting to think that by 2050, 50% of us will be over the age of 65. And with an aging population, age-related conditions like AF, atrial fibrillation, will increase burden on the healthcare system. So why is atrial fibrillation a problem? Atrial fibrillation, AF in short, is known to increase the risk of stroke by 5 times. And AF is associated with an increased risk of heart failure, which translates to increased mortality, decreased quality of life, and ultimately increase the financial burden on the healthcare system. With that, the current hospital-based and physician-centric models of care will not be sustainable, especially when cost containment is imperative to ensure care remains affordable. So Jeroen Hendricks and his colleagues in the Netherlands came up with a solution, a possible solution for the impending AF epidemic. They suggested and also tested the possibility of using an integrated chronic care program to treat their AF patients. So in this particular program that they have initiated, it is set in the acute care setting, one of the specialist outpatient clinic, and it is led by a senior nurse And the program also was guided by a computerized decision support software and supervised by a cardiologist. So in their randomized control trial, they found that amongst their patients, there was improvement in the healthcare providers' guidelines adherence, and also a decrease in the rates of cardiovascular related hospitalization and death. So essentially, in Singapore and also in our NUHS system, we were trying to move our chronic stable AF patients from the acute care setting into the community. And we were hoping to better stratify our AF patients according to their acuity and their care needs. And the integrated care model that we have utilized also involves the use of advanced practice nurse and certain technological tools with the aim of improving patient education and to activate the patient and ultimately cause them to have better self-management. When designing the AF clinic, we went into the literature and looked for a conceptual framework that would help guide the design of this intervention. So we have for the purpose of this AF clinic, we have adopted the chronic care model to guide the design of the specific interventions involved in this clinic. So this is how the clinic is set up in a nutshell. But before I go on to talk about the specific components, I would like to just, for the benefit of our overseas guests, to give a bit of context of what the polyclinic is in Singapore. I believe Wei Feng has already given us quite an extensive sharing about what's being done in the National University Polyclinics, but just a general sense of, just to give it a more general context, in Singapore, the primary health care role is fulfilled by government polyclinics and private clinics. The polyclinics provide subsidized outpatient medical care, health screening, and pharmacy services, with some even offering dental services. Yeah, so currently the Ministry of Health states that only 20% of primary healthcare is currently provided by the polyclinics and 80% is still being provided by private medical practitioners. Okay, so back to our AF clinic that is situated in Bukit Batok Polyclinic. It is, as mentioned, it is led by an APN, and it's actually, as I speak now, it's being led by our previous speaker, Wei Feng. She leads this clinic, and just now she mentioned the specific things that she does as an APN in our clinic, but essentially she does the patient assessment, she screens the patient for concomitant conditions and other risk factors, and she does the bulk of the patient education. The family physician would sit in an adjoining room nearby. He supervises the APN and also confirm the prescriptions. Because when we first started this service, I think Wei Feng hasn't got her collaborative prescription rights yet, or it hasn't really firmed up yet. So at that point of time, the family physician was really, the role was really pivotal in helping with the confirmation of prescriptions. Apart from that, we had a computerized decision support system, which is an electronic flow sheet, which is guided by the guidelines written by the Asia Pacific Heart Rhythm Society. It also went through content validation by a cardiologist and his colleagues. Apart from that, we have a web-based education, which helps equip the patient with some information and some resources for them to view when they're at home. So one thing interesting and also I think is keynote about this service is that we have very strong tertiary hospital support. We have frequent teleconsultation with the cardiologist, and also we have fast-track TTE appointments. So essentially it's 2D echoes. So typically a patient might have to wait, a polyclinic patient might have to wait about 2 months for their 2D echo appointment in NUH, but when they are in our AF clinic, we have it fast tracked. Some patients told me that they can get it as fast as a week or so. Okay, so Wen Tao and Wei Fong has spoken quite extensively about APNs in Singapore. I won't belabor on it, but essentially it is a protected title. We are very privileged to have that in Singapore, and all our APNs are masters prepared and they have clinical competencies for expanded practice. And some have collaborative prescribing authority, and we're hoping that all will have them in the future. At present, the APNs have limited referral rights. Okay, this is a video I would like to show you that our clinic was being featured in a local Chinese news, and just to show you how the clinic looks like. And this is one of our real patients, one of the first few patients that we recruited in the study. So they will be in this private consultation room with the APN doing her patient assessment, interview, and then also essentially let the patient bring home some patient education knowledge. So you can see this is Wei Fong, our previous speaker. Oh, and this is another thing that that all our patients that comes through our AF clinic, regardless their interest to participate in our study or not, all patients will go back home with a name card size card that has access to our website, and also just a spot a stroke acronym for them to just remember how to identify whether or not they are on the way of progressing into having a stroke. Yeah, so it's just things that we tell them to keep in their wallets or near them so that they have reference to it all the time. This is the website that we have developed in our clinic. It gives them information about our polyclinic, introducing them the role of the APN, because some of them may not know what an APN can or cannot do. And then we have videos and some resources for them to read, to know more about AF and how to live with AF, and also some stroke survival stories just to inspire them and motivate them. This entire website has also been translated into Chinese for the purpose of for the viewing of our Chinese speaking or Chinese literates. Okay, so of course, when we come up with such a service, we are hoping to document down the how effective or whether we are doing well with this service. So the aim of our evaluation is to look at the effectiveness and patient acceptance of such model of care, because it's something quite new in Singapore. Usually, if you are diagnosed with atrial fibrillation, you will most likely be referred to a cardiologist in an acute hospital specialist outpatient clinic. So we undertook an uncontrolled before and after study, and we collected data from 3 time points: at baseline, just before the first appointment, at 6 months, and then at 12 months. And the outcomes that we were interested to look at were cardiac hospitalization, stroke, quality of life, atrial fibrillation knowledge, medication adherence, and patient satisfaction, and finally the healthcare providers' protocol adherence. In addition to this uncontrolled before and after study, we have conducted some in-depth interviews to explore the patient's acceptance of such model of care. Okay, so I'll be sharing in the following few slides, I'll be sharing some preliminary findings based on the participants that we have recruited and run the analysis on. So we have the median age, as what Wei Fong has mentioned, is actually quite similar to what was being presented in the Garfield AF study. And most of our participants are male, which also reflects almost the same proportions as the general AF population. Most are Chinese, and then most are married, and most live with their spouse and their children. And they are all quite high functioning because the patients that we see in the polyclinic are the stable chronic ones. So you can see not many of them actually need a caregiver. They are quite ADL independent. They can attend their clinics on their own. So these are some clinical variables of our patient. Most of our patients, as mentioned again, they are chronic and stable. They have a median length of AF diagnosis of 34 months, which is about 2 years to 3 years. As you can also see in this table, most of the patients, you see 86% of them have hypertension and 43% of them have type 2 DM. So we are looking at a patient pool that is not purely those with just AF. They come with other comorbidities as well. Okay, so at 6 months, when we compare our outcomes of interest, we see no significant difference in the cardiovascular related hospitalization and stroke incidence, which is a good thing. It also means that there is no deterioration. Yeah, and as mentioned, most of our patients, they are quite good at baseline. They are quite ADL independent. They are not very seriously or acutely ill. We saw improvement in AF-related quality of life, in their knowledge, in their adherence to medication, and overall patient satisfaction, and their depression scores decreased as well. Finally, at 12 months, you would see that the AF knowledge and medication adherence and depression scores are still on the improvement in the upward trend of being of improving, that it's positive. I would say that for AF-related QOL and for the overall patient satisfaction score, at 12 months, we start to see no significant difference because as we look at the data, their baseline scores were already very high. And just to put things in some context, the Bukit Batok Polyclinic is quite a new facility, and the patients generally are very happy with the service that they receive from the polyclinic even before we started this service. And this would be a quote that was derived from one of the interviews that I've conducted. So this participant said that, I think this clinic is good because we don't need to rush to the hospital that is overcrowded. So our patients do appreciate the location of the service. They don't have to, because the polyclinic is sited in a neighborhood area, and most of our patients, they travel to the clinic by a bus, or they can even walk to the clinic. And so they are very glad that they can receive their care for their AF condition within their neighborhood rather than travel all the way out to NUH for their follow-up appointments. We have also been quite privileged to be featured on World Stroke Day in the Chinese local newspaper and also in the English newspaper Straits Times. This is our 83-year-old patient, one of the first few patients that we have recruited. And he said that, I think I really like what he said. He said, when you go see a doctor, most of the time you feel very nervous. But when you see nurses, you feel at ease. And you can ask them a lot of questions regarding your condition, and they give a lot of good advice. I really appreciated what they have done. So it's very interesting. When I speak to the patients, they have this foreboding kind of mentality going into physician consults, and they have all sorts of questions in their mind, but they don't verbalize it until they see the nurse. So once they step in the room and they see the APN, they start gushing out all the questions that they have been storing. So it's really quite interesting because they felt that there's no barrier between the APN and the patient, and it's easier to communicate to the APN as well. So sustainability, is the APN-led integrated AF clinic here to stay? So when we talk about sustainability, we need to make sure that patients, which is our key stakeholders as well, and other stakeholders like the health administrators and leaders need to experience and see the value it brings to care. And we're very fortunate that, although this service started out as a research study, the value of it has been recognized by the patients and and by healthcare administrators and leaders. And that's why it started as a research, but it's now, I'm very happy to say, is now a permanent service in the polyclinic, and it's being subsumed under Project Vector. Yeah, and I think that this APN-led integrated AF clinic would be a very good potential precursor to other clinics devised to optimize chronic disease management in the community and APN-led services. So moving from this AF clinic, in addition to this AF clinic that we have implemented at Bukit Batok Polyclinic, there is plans in the pipeline to start an IHD clinic that is also led by an APN. So with that, I'd like to end my presentation. I'm happy to take any questions later. If not, you can feel free to contact me at my email. Thank you so much.
Thank you so much, Bridget. I think your work have showed it's so important for the researchers and APNs to work together to develop APN services and ultimately benefit to our patients' care. Thanks, Bridget. Now, last but not least, I would like to introduce Prof. Ruth. Prof. Ruth is not new to our local APNs. She has been with us since the APN training established in 2003. She has witnessed the Singapore APN's development since then. So Prof. Ruth is an Associate Dean for Clinical Scholarship, Independence Foundation Chair in Nursing Education, and Professor at Vanderbilt University School of Nursing in Washingtonville, Nateshi, USA. She is certified as an acute care nurse practitioner and is known nationally and internationally for her expert related to the APN role. She has published many papers and books related to APN outcome and development. Without further ado, I would like to pass the time to Prof. Ruth. Ruth, please. Thanks.
Great. Well, thanks so much, Wen Tao. I'm delighted to be participating and certainly want to congratulate all of the advanced practice nurses and those of who are joining us today who are advanced practice nursing students on all of the progress that you have made to develop and expand the APN role. I've been watching from the sidelines, and it truly has been a pleasure to see all the progress that you have made. So I'm delighted to be joining today to speak just a little bit about identifying the impact of the APN role, because that certainly is an important aspect. In the United States, we've had the APN role for over 50 years, and we still find that we need to demonstrate the value and the impact of what we do in order to expand the role and develop new roles and really to progress in the care that we provide. So I'll be talking a little bit about ways that APNs can demonstrate impact in their role and strategies for showcasing APN outcomes. And oftentimes practitioners will say, I am busy with practice. I don't have the time to really look at what I'm doing in terms of outcomes, that I don't have time to do research. But the reality is that before you start a new initiative, it's a simple process. You pause to collect some baseline data and look to see the impact. Certainly, if you have the value of having someone like Dr. Bridget Wu to be able to help you with formal studies, that's wonderful as well. But all APNs can look at the impact that they are making in their role. We know this is important because APN roles are expanding. And to be able to showcase the value of our roles, we need to be able to demonstrate that to key stakeholders, as well as the public and other professionals that we work with. So APN roles do add value, and we've actually had some nice exemplars today from Wei Fong in terms of her practice, and Wen Tao highlighted some others along with Dr. Bridget. Certainly all APNs add value in some way to aspects of patient care, to education, to clinical nurse satisfaction, but being able to tease out what we do in our roles to showcase that is something that we need to take pause to. And there's many examples in the literature about ways that APNs impact practice. And sometimes that's a good starting place, is to look at the literature related to your specialty practice as an APN to get ideas, to replicate methods that may have been done by other APNs with respect to specialty roles. I've had the opportunity to join forces with over 30 APNs to look at outcomes in advanced practice nursing. And it's clear from the literature that outcomes is something that is feasible and doable for APNs, regardless of their number of years in their role and regardless of their role itself. And there's some essential steps to looking at outcomes. First, looking at the APN role. What are aspects of the role? As Wei Fong shared, is it dealing with specialty patients such as those with atrial fibrillation and the impact of a clinic care model? Looking at what are organizational priorities within the setting that one's working, whether it's in the hospital setting. Are they trying to decrease infection rates? Are they trying to decrease rehospitalizations? In the clinic setting, are they trying to decrease wait times? It really depends on where the APN is working and what they're doing. But looking at key metrics that are important to stakeholders is another starting point as well. As I mentioned, looking in the literature for examples that have been published, particularly in specialty areas of practice that an APN is working. And then to identify outcomes that one could select, and ideally ones that are already collected with respect to the electronic health record and reports that exist. How can those be redirected to the APN to look at the impact of perhaps their panel of patients or their specialty area of care? And then develop a plan to identify impact. How can one go about looking at the impact of their role? The literature is clear that many, many metrics can be used. It really depends on the APN's key roles and functions. These are but a few of the outcomes that have been demonstrated to be impacted by APNs, whether in hospital care or outpatient care or specialty care, such as palliative care, looking again at even the impact of the APN role on patient and family education, and also on ward nurses and clinical nurses with respect to their education and retention and satisfaction in their role. So many, many outcomes to select from. Really, the key is what is reflective of the majority of the way that the APN role is structured. So how do APNs impact outcomes? Looking at ways that you bring value to your clinical care. So is it providing quality of care? Is it decreasing costs? We call these, what are the metrics that matter to your key stakeholders within your setting? And how can you contribute to moving and improving those metrics that matter? I have a short video to highlight a little bit about the process as well. So it really is a process that requires the APN to really be able to reflect on their role and to assess specific ways that they are able to impact care, and to be able to highlight that and to publicize that, to put it in newsletters, as was shared, have media coverage within the organization, to be able to have posters to publish, to really showcase the value of APNs. And that helps to garner support then for increasing the number of APN roles as well. So points to consider, as I mentioned, what are outcomes that are valued by the organization that the APN is working at? What are outcomes that may be valued by the practice specifically? If those are clinical outcomes, are they evidence-based? Is the APN implementing new evidence-based protocols, and what are the impact of those protocols on patient care? Are the outcomes directly affected by the APN with respect to APN clinics or APN run program? How will the outcome be measured? And ideally, it's being able to have reports generated by the electronic health record or other information services, so that the APN is not responsible for collecting that outcomes data, but that the reports are generated for the APN. So data that's being already collected, how can that be redirected to APNs to have data with respect to the impact of their role? Now, I'm currently at Vanderbilt University School of Nursing, and I've been delighted to be here for the past 7 years to be able to witness the roles that they are having and what they are impacting. And one of the things that drew me to Vanderbilt was the large number of advanced practice nurses that they have within the medical center. Vanderbilt University has over 1,000 beds, and they have 1,300 advanced practice nurses throughout their healthcare system. So not just the hospitals, but a variety of clinics, a variety of community settings. My area tends to be the intensive care unit. That's where I practiced for over 15 years in a surgical ICU before becoming an advanced practice nurse. So I have done a lot of work with the APNs that work in the intensive care unit. And this is a group from our medical ICU, and Jana Landsberger led a study there that was a prospective cohort study of all the admissions to the medical ICU over a 2-year period. And they had over 9,000 admissions that they compared an APN-led a group within the ICU. There's 24/7 coverage of advanced practice nurses, and they have several teams. So one is the advanced practice nurse team, and there's 2 resident medical teams. And so they compared the APN team patients compared to the resident teams, and all the teams had attending physicians that served as consultants. And they found that over a 2-year period, there were no difference in terms of length of stay or 90-day stay. There was a lower risk of hospital length of stay, lower mortality rate, and lower ICU admissions in the APN team, showcasing that the APN team was able to manage critically ill patients with respect to the care that they needed. Another one of our teams, Nina Collins and her colleagues, studied the impact of the APN role in trauma care. The trauma nurse practitioner role was introduced in 2011 with advanced practice nurses covering the unit 5 days a week with a pilot program. And they compared length of stay for 1 year during this pilot, where they had advanced practice nurses assist in the management of trauma patients, and compared that for the 2 years prior. And they found a definite benefit with respect to decreasing length of stay and improving physician and nurse satisfaction among members of the team. And that helped to add support for then extending the pilot into a full role with 7-day-a-week coverage in the trauma ICU as well. And they showcased not only an impact on patient care and reducing length of stay, but also on costs and on really looking at improving the workflow. You know, the continuity of care, which is something that's highlighted a lot in the literature, was also reflected in their trauma review of the impact of their care. Another team, this is Erin Burrell and her colleagues who are on the rapid response team. In 2017, they developed an APN-led rapid response team that had a virtual physician coverage, and they were staffing at 7 a.m. to 7 p.m. 7 days a week for 9 months. And they looked at the over 500 patients that they were managing with respect to their rapid response team and compared it to the prior rapid response team that was physician-led. And they were able to showcase that with the APN-led team, they were able to impact not only length of stay in the hospital, but also in the ICU. They were able to have better throughput and look at increasing patient and staff satisfaction as well. And they also just didn't respond to patients needing care that the rapid response team was summoned to. They actually did proactive rounds on each of the units and outreach to the wards to check were there any patients that the nurses perceived, weren't doing very well or they should check on. And so by this proactive rounding, they were able to showcase that 18% of those over 500 patients were actually moved to a higher level of care in terms of their proactive care to prevent unanticipated cardiac arrest or patient decompensation. We've also been able to showcase, as I know you have, with respect to newsletters. This is Heather Jackson, one of our advanced practice nurses who uses acupuncture therapy to help manage pain. And this was showcased in our Vanderbilt Reporter, which is our weekly newsletter. So, showcasing the APN role and highlighting that to key stakeholders on a regular, ongoing basis also brings attention to the APN role. This is Lauren Oliver and Jamie Gibson. They're two of our APNs in the cardiovascular ICU, and they looked at a year-long initiative to reduce unnecessary chest X-ray use. They did a baseline to see that the X-ray use in the unit was over 100%. It was like 140%, meaning every patient had more than one chest X-ray every day. And it was just sort of routine. So they revised the guidelines to say only patients who, had a need for chest X-ray rather than doing chest X-rays on every patient every day. And they were able to decrease significantly the amount of X-rays as well as the costs of care. And so it highlighted again the role of the APN in really impacting and improving patient care as well as healthcare costs. And this is Clint Leonard. He's one of our APNs in the burn unit, and he focused on reducing unnecessary blood tests and blood draws, particularly in burn patients, and showcased over time not only a decrease in use of lab tests, but also an increase in 0 lab days. So burn patients who had no labs on days that they really didn't need to have labs. And this is something that really hadn't been tracked before. So it showcased, again, the value of APN-led care. So in summary, there's many ways to highlight APN care, and I've tried to share a few strategies that can be used, but certainly, collectively, APN teams can start by looking at what is it that they're focusing in on their role. How can they gather information on their impact? What data can be collected? And to be able to demonstrate this not only to other APNs to encourage them to look at their impact, but also, again, to be able to further expand the APN role, which we're seeing globally. The role is still being developed in many countries, and we're seeing benefit to the role, but we need more data to be able to validate why countries should put forth resources and education and support for nurses to take up the course for advanced practice nursing. So thank you so much. I really appreciated the opportunity, and I look forward to our question and answer session as well.
Thanks, Ruth, for sharing with us the strategies to be used to identify APN outcome. In Singapore, we're still discussing how to actually best ascertain the APN outcome to be measured and demonstrate the APN's contribution to the healthcare system. So I believe your talk, and particular your research study and your book, will shed some lights to our local APNs. Thanks again for all the speakers to share with us your journey, either is in clinical practice or in research or as a leader leading for the APN development. I think there is a lot of wonderful sharing. And thanks for the participants being with us throughout. And we hope you enjoy the session. Now, let us proceed to the Q&A session. I have seen quite a few burning questions. I stick there. I will answer that on live. Maybe for the other speakers, you can also let me know if I miss any of the question you think is really important to be addressed. So there are two questions I think I would like to address up front. One is regarding government actually asking for 700 APNs by 2030, whether we are on time to catch up the 400 plus APNs training, which we only have 300 for now. So I think that is really need to have from the top down strategic planning, because looking at 400, 9 years to develop that number per year, we need about 40 to 50 people come into the program and being trained. So that is really need to plan ahead in order to achieve that goal, but it's possible. So following that question is another question is regarding, I have mentioned actually APN in a strategic position to lead for healthcare because they are versatile, flexible, and adaptable, and system focused. Then how would this apply as a part of selection criteria? I think in order to train all these people become so versatile, one part is selection. We need to select appropriate candidate to come in. But on another side, it's really a training process. It's really a culture or the practice, the clinical practice culture, environment, how nurturing it is. We select the correct candidate, or we select the candidate they are willingly to move on as an APN. So we need to do more and more promotion to let people understand what is the APN role, what is the APN contribution. We select them, we train them, send them to the school training. Then the school must really have the same vision to train them to be competent, to be visionary APNs for the future practice. After they graduate, they back to the clinical. The clinical need to have a nurturing environment to support them to success in their role in the future. I really agree with Sophoon. The clinical leadership, the environment, the relationship to supporting all these people to be visionary future nursing leaders are important. So I think there is multiple factors. It's not just the selection criteria. I hope I can address that question. Okay, thanks. So let me move on. I think there is a question about can the APN course to be self-sponsored? Unfortunately, at this moment, the course is a MOH-funded program. It's only through a selection criteria, through your selection in your hospital, then you get the chance to come into the program. But however, I think Bridget have done a study to look at the local RNs, how do they perceive their willingness to become APN in the future. I think that study actually gave a lot of insight to the nursing leaders, as well as Ministry of Health is aware of that study and hope that can make some changes for whether people are willing to come into the program can be self-sponsored. But however, I think at this stage, we really hope the APN development can be protected, because you need to have a well-supported environment to make sure your role success. Okay, so now I will hold on for my portion study. I will pass some of the question to Wee Foon. I know Wee Foon, you have answered some. And there is a question, if I remember correctly, they are asking what is the difference between primary care and community care. It's all right for you to address that.
Yeah, so since we are on this question, I will address this question. So for community care is essentially is an umbrella term to indicate all the care across the community. So primary care is part of community care. So if you look at community care, it includes the step-down care services, include your nursing homes, your community hospitals, your long-term care facilities. So primary care is part of community care. So that is probably the answer that I would like to address for this question. So moving on, I think one of my APN colleague has also shared and asked about whether the AF clinic, how often is the AF clinic held? So AF clinic for APN runs 1.5 days a week on Thursday afternoon and full day on Fridays. So for the family physician the family physician collaboration with APN is only done on a Friday afternoon. Yeah, so this is the answer to that question. The other question is quite interesting. It's from Sarah, who actually asked about whether polyclinic is considering grooming APNs to care for pregnant mothers and postnatal mothers with babies. Okay, so at this point in time, there are actually initiatives from the hospital for us to look at postnatal mothers with gestational diabetes. So we are actually still in the midst of discussion for APNs to review the patients postnatal on their OGTT as well as their diabetes sugar control. So this is something that is in the pipeline. And moving forward, if the group of postnatal mothers with GDM increases, then there are a lot more expanded role that we can actually look into to address these population needs. So this is something that we have been considering. Yeah. So
Thanks, Wei Feng, for addressing that question related. I think I will now direct the question to Prof. Roos. There are two questions actually to you. One is regarding what do you think about the future role of acute care APNs, considering the current focus trends is towards primary or community care? And how can acute care APN contribute and adapt to the change needs of the community? Yeah, Prof.
Yeah, good question. And that is something that we have found that as we expand community care, we need acute care nurse practitioners to manage patients in the community who may be, for instance, heart failure patients who are possibly on home titrated medications and need, an acute care nurse practitioner. So we have been looking at that scope of practice, the scope of practice for primary care versus acute care. And there are many new roles and niche areas as we move into the community and ways for both community as well as acute care advanced practice nurses to work together and collaborate. So I think there will always be a need for acute care, but moving into the community offers the opportunity. And I know, that Wei Feng indicated that you only have 20 some in the community. So certainly a great opportunity is to groom APNs for an interest in working in community as well.
I think there is another question is regarding how to gain funding to support APN initiated project while financial outcomes may not be always feasible to measure. I think this is a good question.
It is. And, costs of care, an APN may not be directly impacting cost of care, but if an APN is increasing the use of palliative care and bringing, patients' quality of life and impacting their satisfaction, those are metrics that matter as well, just as costs. You may not be able to showcase costs of care, and funding is always something that can be advocated for. I think I'm going to have Dr. Bridget speak a bit to looking at resources for assessing APN outcomes. I know in the U.S. we have some foundational funding as well, but I'm not sure if the ministry supports, or Bridget, if you could speak to that.
Yes, definitely. We have competitive research grants that we can apply for. But generally, now we have this MOHT, which is the MOH transformation arm of MOH, where they look at how we can transform care, and they are providing a lot of funding at looking at how we can transform healthcare services, and the use of APNs in such services is one of their interests as well. That is one example would be Project Vector, something that Wei Fong has spoken about. So our AF clinic wasn't really funded to begin with. Yeah, it started off as like a PhD project of mine. We used whatever resources we have from my PhD funding. And then because of its the outcome that it has produced and the feedback that it has received from the patients and also the healthcare administrators, what happened was this model of care was deemed very good, and so was subsumed under MOHT's one of their pet projects called Project Vector. Yeah, so this is one example of how funding can come through. Funding may not come initially, so at the start of our AF clinic, I did try to apply for several competitive grants, not even competitive grants, some seed grants, but unfortunately we didn't our grant, I guess the grantors did not, or the people assessing the grants were not very interested in such a service or such research. So we started out without funding, but subsequently, we produced certain results, and then funding just started to come. Yeah.
Thanks, Bridget. I see a lot of very good questions. Let me move on to the next question on the list, which is, there is one question is to Prof. Roos. Appreciate your advice for our APNs to engage ongoing clinical research for service innovation. Will you consider a clinician scientist career path important for APN community?
Yes, definitely. And we do have APNs who are conducting research either as part of their role or after they practice in clinical practice. They take opportunities to conduct research, particularly related to the APN role. So that is certainly an opportunity for APNs as well.
Maybe I move on to another question. It's regarding, is it that after graduating as an APN, the prescribing right is not automatic? So for this part, currently, the prescribing program is after they become a certified APN, then they come back for the prescribing program. After the program, then they get certified to be a certified prescriber. It's not part of the Master of Nursing training portion. But however, with the new structure of integrated APN internship, that will be inbuilt to the internship. If the APN intern perform well on PAL, they will come back for prescribing. So at the end of their certification, they will have the APN certification as well as the prescribing right. So this is the current structure. But however, moving forward, we may evolving for this structure. So thanks again for all the questions. I know there are some questions we have no time to address that, but we will follow up with all the questions to provide the answers. We will reach out to people, to all the participants about the answer to the questions. Okay, thanks again. Time passed fast. It's the time for us to say bye-bye and end for this session. I really hope you have gained something from this sharing. I hope more interaction or more collaboration can be happen after this webinar. Thanks again for attending our webinar. I will see you again. On behalf of the committee, we thanks for your participation And we look forward to have you back for our next nursing webinar. Have a good day and good weekend ahead. Thanks.
All up in my head, fear's got a hold of me. Pretend I'm not scared of who you're calling me to be. Truth is, I don't think that I am good enough. Must have someone else that you were thinking of. Who am I to be a part of your plan? Then you told me who